Welcome, everybody. Today, I talked to the task force about health workforce education, addressing three questions. Where do we come from? What are we? And where are we going? Of course, we all know that the current pandemic not only revealed the weaknesses of health systems, but also the long existing weaknesses of health workforce education. And now, on the complex road towards the new normal, even more than before, we understand that we should aim at educating future and current health workers who should work efficiently in the context we can't predict. I believe that we should widen this question to see the complexities behind women's health, women being health professionals, and women being carers. And this is exactly why we should go beyond discussing the health professions education towards health workforce education, and further to also include patients and populations education to achieve the human capital for health and to achieve One Health. And this means health of populations, health of animals, and health of ecosystems. Currently, we are definitely too often involved in separate discourses on strengthening education and on strengthening health systems, on all levels of education and on individual professions education. What we clearly see now is that to respond properly to the contemporary challenges, health professions curricula should adapt much faster to constantly changing societal needs. They should definitely respond to the European WHO program of work, including a coalition for mental health, digital health and innovation, immunization agenda, and leveraging behavioral and cultural insights for health. Moreover, they should respond to the United Nations Sustainable Development Goals. Let me give an example of the WHO Academy as a new, responsive, and inclusive global educational initiative. At this moment, I would say that I see transformational leadership in healthcare and in education as a sort of an overarching competence, both for the health workforce and for educators, necessary at every level of their professional development. And again, let me present the WHO Pan-European Leadership Academy, being an initiative responding to the need for transformational leadership competence. Let me use the AMI statements for the recent WHO Europe Regional Committee meeting to summarize the take-home message. We should focus our attention on making the European health workforce learning opportunities more proactive to the needs of populations, on providing the appropriate human and financial resources for development of the high-quality, inclusive educational opportunities. I would say this is one of key messages for this audience. We should focus our attention on increasing the involvement of experts in health workforce education in initiatives aimed at strengthening health systems, increasing the role of patients and populations as partners in education. Furthermore, we should aim at supporting the development of the European community of good practice in health workforce education, breaking the silos of individual professions education and moving towards interprofessional education for interprofessional practice, addressing the lack of coherence between all levels of education in CPD and moving towards a continuum of lifelong learning opportunities. And finally, on providing lifelong learning opportunities, not only for health professions, but also for health workers with no professional qualifications, often forming the core of healthcare, and on ensuring that the learning opportunities are available for all and are adjusted to their diverse needs to leave no one behind in education. Thank you for your attention.